Okay, so in this scenario we're going to talk about sort of themes around molecular pathology. And this story, there was a 30-year-old lady who had received for Christmas a DNA sequencing kit. So one of these ones that is sort of direct to consumer that you can then send off a sample and they then give you the results of it. And her aim for doing this was that she wanted to learn a bit more about her genetic ancestry, about where she'd come from in Europe, etc. She sent the saliva sample off as requested, and a few weeks later she got the information back, but it was highlighted in the report that she had a BRCA mutation and that she was at increased risk of ovarian and breast carcinoma as a result of that. Now you can imagine what sort of impact that's going to have for someone. But not only that, her friend, a very close friend of hers, a 45-year-old lady, had recently died of breast cancer as well. So it was a very emotional time and very sort of pertinent to get this information. So she took the right action and went to see her GP about it, but unfortunately the GP wasn't able to give her any reassurance about it, and also there was no sort of information scientifically about the sequence, etc., that had been provided by the report, and so the GP had to refer her then to the molecular pathology and genetics department of the local hospital, where she had her DNA resequenced, and they were able to actually tell her that it was in fact just a non-pathological variant, so it wasn't pathological. She wasn't at any increased risk of ovarian or breast carcinoma as a result of it. Again, thinking about the sort of patient safety issues as a result of this, it's not only the fact that she's obviously gone through an emotional roller coaster as a result of being told this, but potentially in knowing what we know about with BRCA mutations, etc., and sort of the prophylactic things that you can do, if this hadn't have been investigated and determined, then it could have been a very different outcome for this patient. So if we think now about a bit more about this story, how do we think this actually happened? What do we think?
I mean, these go to non-accredited laboratories, sometimes even abroad.
Mm-hmm.
And you can't really trust results coming from them. It is good for fun, but when it comes into like medical conditions which could cause significant impact to the patient, you would want this result coming from a laboratory which you can trust. That the results are validated and that they actually are accredited laboratories within recognized organizations. So. I think it's the availability of the test is what's really a problem here. So everyone can buy like a over-the-counter test and send it away. It's easy to be sent, and then you get a result in an envelope after that many weeks or months.
And certainly I know over the Christmas period, every time I switched the television on, there was a different company that was sort of advertising this as well. So I think it's certainly the general public are more aware of this now. A lot more of them are actually engaging with doing it. As the example here, it's a good Christmas present or birthday present to give someone and finding out a little bit about their ancestral history. But again, it's the other things that maybe are not said in these adverts about what potentially could be derived from that as well. And a bit like you say, you don't know where these samples are being sent and what the accreditation of these labs actually are. Are there any other points that we can think about where the error might have occurred with this as well? What other things do we need to think about with this?
Realistically, when you're sequencing things genetically, it depends on exactly what tests have been done on it. So if it's things like whole exome sequencing or next generation sequencing as it's called, that actually has quite a high error rate a lot of the time. So just getting one mutation, it then needs to you need to prove that mutation's there by a more stringent method.
Absolutely.
So realistically with these things, they always give a snapshot, a brief overview, if you will, kind of to explain there may be this mutation there, but you really need further tests to prove it. So the other thing with mutations is that you don't know where in that gene that mutation's actually occurred. So although you have a gene that's got a mutation in it, that mutation may not actually cause the disease.
Absolutely.
Which seems to have been the issue in this case.
As you say, in genes, we all have little letter changes that can occur, and it's where they occur that's actually important. So one single letter change in a particular location could be very pathological and cause horrendous problems for a patient, yet in another location could be in the same gene, could be just a variant. And that's the important thing, is actually determining what is pathological and what is a variant, and communicating that in the right way to a patient who may not have the scientific knowledge or awareness of those sort of things.
Absolutely.
I think there's a big issue as well about a lot of these companies often send the data. They may do the sequencing, etc., but then send the data to other third parties to actually analyse it. And again, the experience and background of those places, there needs to be some form of sort of quality control to actually make sure that these are being interpreted properly. And certainly in my experience with my PhD in sequencing as well, there are alignment issues, there are all sorts of things along the process which can really influence what the outcome of that result actually is. And thankfully the resequencing was able to determine this situation.
Yeah.
Do we think there's any, what about the GP in this scenario? What do we think about what happened from that point? He wasn't able to offer any reassurance.
Yeah. I think it's really, really hard because the information that they would go on is just what the company had provided. So it's very, very limited. And hopefully the GP would be able to say something like, we don't know yet, so don't try not to worry about it, and try to provide some reassurance, just as we've said, by saying things like, you don't know that this is necessarily going to cause a disease. Yeah. So just informing people of these things can provide some sort of reassurance. But I think that it was completely reasonable that they get retested,
yes.
and further investigated.
You can't just dismiss it by saying, well, give her false reassurances when you don't really know what the truth is. Can't trust the test that she's got, but at the same time you'd have nothing to kind of rule it out. Or
Absolutely. Do we think the patients are actually aware of what they're actually undertaking sufficiently? Do you think they have enough information about these tests?
No, I don't think so. I really don't think so.
I think you're expecting it to come back with some information about your ancestors, but then you're actually getting all sorts of other things along with it. So kind of that's not what you paid for.
Absolutely.
But it's.
I think there's the issue of awareness on both sides. So from the patient side of things, what the information they're going to get back from, and also the implications if something is found, if there is a health check associated with this, what could be found, but also it's not just them, it's also potentially for the family, other family members as well. So there's a whole chain of people that could potentially be affected by these. And again, a false positive, as in this case, could have a massive impact on, you can see how big that impact could be potentially on this whole chain as well. But I think it's a big, this is something this GP has experienced, but I think a lot of GPs are now going to be experiencing it in the future as well, as more and more people undertake these tests. It's now in the public eye becoming a much more, they're expecting to have sequencing done for different diseases as well. And I think it maybe is an argument that all of us now, no matter what specialty, not just in pathology, but actually all specialties need to have a bit more background in sort of molecular pathology potentially as well, and how to sort of scrutinise these results. But it definitely needs some sort of quality control associated with it and some form of regulation to make sure that when someone is told this information, there is a solid grounding and it's been QC'd, as we call it, to make sure it is the right result.
Yeah.
Actually, it's not just really, these kits are not just available for molecular testing on it, like on its own. We see it also in infection when things like Lyme's disease.
Okay.
So you can buy over-the-counter testing kits,
Right.
which again you just give the sample, send it away, and then you get a result whether you've been exposed to Lyme's disease before or
Goodness.
not. And again, you don't know how these tests have been done. You don't know what the validation of the laboratories are, and then you're left with a result which could impact your
Absolutely.
life or subject you to unnecessary treatment. And then obviously some patients get fixated on this, demand treatment, and it triggers just like an unnecessary events really around trying to disprove the result. And sometimes even when you get results back from reference laboratories which are accredited, I've got like more transparency about the results. They sometimes just the patient themselves disapprove it if they totally believe in.
I can see it if you've got one test that's actually telling you yes you have had this, and then you've got the other which is saying you've not. So I mean, there's a whole issue of trust and honesty in amongst that.
Especially if you can correlate to some health issues that you've got and try and pin them on this positive result to try and get an explanation.
Absolutely, because you can imagine someone's not going to just do this test for no reason. It's just going to be, they're obviously feeling unwell, that they're trying to seek it, and maybe it's been a challenging sort of relationship with the healthcare services to find out what's wrong, etc.
And in this, in our case, like with Lyme's disease, unlike the case we've got with molecular pathology, is that you actually, in order to confirm the result, it will have to go to an accredited laboratory. But in our case, we've got different laboratories in the world which does the test, and the patient can send samples to. And also, you've got doctors who just benefit from treating patients with Lyme's disease, and they've got a huge private business out of it.
Okay.
So you've got options other than the NHS to go to, which sometimes patients see satisfaction in if they are treated and seen in these kind of practices, which again doesn't really follow any of the national guidelines.
No, absolutely. So if we think back to our scenario here, what sort of learning points can we derive from this example, do you think?
I think what happened was quite good in terms of the GP referring them on, and I think the patient did the right thing by going to their GP and having a chat. But realistically, there should be more information from these companies as to error rates and what they're picking up, and there should be a lot more information. People need to be informed about these things. And also potentially some sort of regulation, but I think that's going to be quite difficult to implement, really.
Yeah.
I think the other point to raise is about what happens to this data, and are patients actually aware of what's going to happen with this? Because are these companies then going to sell it to other organisations or research organisations, etc.? Are they fully aware of what they're actually is going to happen? And I think that's another big
signed for when you do one of these tests.
Absolutely. So I think, as we agree, regulation is definitely something that needs to be aware of. I think. Some form of QC needs to be, and regulated so that people are not getting misinformation and being worried unnecessarily. I think awareness for all, I think the whole healthcare profession and the general public about what patients are actually undertaking and what potentially could come from this, as well as how we interpret those results, are going to be important things to consider with this case, definitely. Thank you.